Well, in this week's Cardiology Countdown, we'll talk about red meat consumption as we go into summer, also the prevalence of metabolic syndrome, and an interesting study about troponin T and peripheral arterial disease. So to begin with, there's a huge study looking at 3 different large cohorts and nearly 2 million patient years of follow-up that looks at red meat consumption and indeed changes in red meat consumption versus outcomes. In particular, the outcome of developing diabetes. And so they looked at a 50% increase or decrease in red meat consumption and found that for people, and these were physicians or nurses in these cohorts, who increased by 50% or a half a serving of red meat per day, they had about a 50% higher risk of developing diabetes. Conversely, those who decreased by half a serving a day had about a 14% lower risk of developing diabetes. And so I think food for thought. There have been recent studies on the benefits of a vegetarian diet, all sort of pointing towards reductions in meat as a way to improve outcomes or, in this case, risk of diabetes. Now, a second study published in JACC online this week looks at the prevalence of metabolic syndrome. And fortunately, some good news in this era of the diabetes epidemic, that the NHANES data suggest a reduction in the prevalence of metabolic syndrome from 25 down to 23%, so very modest. And this was driven by lower rates of hypertriglyceridemia and elevated blood pressure. Conversely, 2 of the risk factors went in the wrong direction. Hyperglycemia and waist circumference both increased over the period from 1999 to 2010, so about a 10-year span. And so this was due largely to increases in antihypertensive and anti-lipid agents. And so while the lifestyle side of the equation is getting a little worse, and the diabetes side, at least the blood pressure and cholesterol side, is improving. Clearly, we need intensive improvements in lifestyle and appropriate medication use, but hopefully a little hint of some positive trend in the risk factor count overall for the United States. This week's number 1 pick is a very interesting study looking at troponin in peripheral arterial disease. And this was a cohort of over 1,000 patients with peripheral arterial disease undergoing intervention. And they looked at pre-intervention troponin and found that those with elevated troponin, which comprised about 1/5 of their population, had about an 8-fold higher risk of death. It was 32% versus 4% in absolute terms. They also had a higher risk of MI, 4% versus 1%, and the risk of amputation following that revascularization procedure was higher as well, 10 versus 2.5%. This was independent of renal function, and so highlighting, I think, another group of patients where troponin can be very helpful. And to that end, there's a terrific review also in JAMA that James DeLemos has done, reviewing the high sensitive troponin and all of its use overall, that's also worth looking at this week. So for this week's Cardiology Countdown, I'm Chris Cannon.